Welcome everyone. Good morning, Manila. Everyone can hear me, right? And good evening, North America. I am Elmira Roque. You can call me Ming. I live here in San Diego, California. Everyone will be muted for better sound quality, but feel free to type in your questions or comments on the chat box. So this event is provided by CCG, and our organization is about leadership, search, development company that empowers everyone in personal growth and entrepreneurship. So in our CCG community, we believe in three values: optimal health, optimal wealth, and optimal wisdom. For tonight, we'll be focusing on optimal health. Let us learn more about heart diseases and its risk factors. It's important for everyone to know the facts about heart disease. So for tonight, our guest speaker will give us information about this vital organ. Our guest speaker is a surgical oncologist, a personality development and wellness coach. He finished his medical education at De La Salle University, finished his master in business administration degree in Ateneo. He also did fellow of the College of Physicians and Surgeons. He is also an on-demand international speaker, been to Malaysia and other countries to speak. So even now that he cannot fly to other countries, he does Zoom internationally, just like what we are doing now. So please welcome my trusted best friend and our eldest brother, Dr. Roel Tolentino.
Thank you to my favorite sister. Siya lang eh. Good morning everyone and good evening in the US. So the topic is please be careful with your heart. Now, for the objective, at the end of the lecture, the audience will be informed on how to improve heart health. Please take note that in order for you to live longer, you should have a very healthy heart and very good or outstanding healthy arteries. No blockage, no constrictions. Now I'm being invited in some radio and TV programs to give similar talks on health, self-improvement, personal development, etc. Key facts: over 75% of cerebrovascular disease that takes place in low and middle income countries. We are living in the third world, so many of our countrymen are suffering from cardiovascular diseases. Now, what is the main cause of this kind of disease? Heart problems. It's due to inflammation, and we know that inflammation is due to the foods we eat, our health habits, our sugar intake, our intake of trans fatty acids. So with inflammation, it causes so many chronic diseases, some of which are cancers, cardiovascular diseases, diabetes, lung problems. We all know the causes of oxidative stress, including smoking, diet, alcohol, stress, eating fast foods, etc., etc. Now, this is our heart. Remember that the arteries in our hearts are end arteries. What do you mean by end arteries? There are no collaterals or if there are collaterals, there are only few collaterals, meaning if one artery is blocked, then the muscle it supplies will suffer, will necrose, will die. Therefore, we need to take care of our arteries, especially in our heart. Why? Because as I have said, it will promote ischemia, death of the muscle in the heart, and if you have necrotic heart tissue, then it will not pump as required by the heart, and you will have congestive heart failure, ischemic heart disease. Now, for the heart disease, we have coronary artery disease. Coronary artery disease means you have problems with the arterial supply of the heart, also known as coronary heart disease and ischemic heart disease. With cardiomyopathy, cardiomyopathy is the disease of the muscle of the heart. Cardiomyopathy may be secondary to bacterial or viral diseases. We have also hypertensive heart disease, diseases of the heart secondary to high blood pressure. Why? If you have constriction in your arteries, then it will burden the heart in cardiac output. Therefore, the heart will be stressed out. It cannot give oxygenated blood to the tissues. And of course, we have heart failure. Heart failure is secondary to ischemia of the heart. If you have heart failure, what will happen? Your heart will not pump and you will end up dead. Heart failure. For the antioxidants, very important that we load our blood with vitamin C and B, which are water-soluble vitamins. As far as I know, there is no toxicity with high intake of vitamin C and vitamin B as long as it is organic and not processed. For the fat-soluble vitamins, we have vitamin E and vitamin A, and these vitamins are very important for our arterial and venous health. Fat-soluble vitamins also used by our cell membrane in the human cell. What causes heart disease? Stroke. Please remember that arteries, these are blood vessels that carry blood away from the heart to the rest of the body. This is our normal artery. You see that there's no blockage. But with atherosclerosis, meaning blockage with calcium, with platelets, you will have a hardened artery and constriction of the lumen. Plaque starts to build up. There will be a tear in the arterial wall because of cholesterol deposits, most primarily the low density lipoprotein. Again, remember, low density lipoprotein is a cholesterol which is the one blocking your artery. And if you want to know if you have increased LDL or high density lipoprotein, they're good cholesterol, you go to the laboratory and have them check. You can have laboratory examination for cholesterol, triglycerides, low density lipoprotein, and high density lipoprotein. I had my examination done about 2 months ago and I was surprised. My LDL was very high. However, my HDL is also high. But I have now I have problems with triglycerides, probably because of the low activities during the pandemic. No? So that's why we have to start our regular exercises. Plaque can grow and harden and obstruct the artery. It is not only the heart which is involved, but also we have end arteries in our brains. Be careful not to eat too much trans fatty acid because you might end up with brain stroke. We all know this, atherosclerosis, deposition of fatty materials in the arterial wall.